Hi, my name is Alison McMillan and I'm the Commonwealth Chief Nursing and Midwifery Officer.
Hi, I'm Marion Saville. I'm the Executive Director of the Australian Centre for the Prevention of Cervical Cancer, and I chaired the working group for the latest revision of the guidelines. So the great news is that as of July 1, anyone eligible for screening is eligible to choose self-collection as their screening test.
Everyone who's eligible for screening for HPV, but not for the co-test, should now be offered the option of self-test or clinician-delivered test. Of course, a woman should still have the choice of a clinician test should they prefer. Self-testing is particularly important for those in the population who've either been hesitant to be screened or for those where screening has been uncomfortable.
Provided PCR tests are used, self-collected samples are just as accurate for the detection of pre-cancer as the traditional clinician-collected samples. That's what's underpinned this change to the policy, and you should be reassured that all laboratories in Australia are required to use PCR tests when processing self-collected samples.
There's now strong evidence that self-testing does increase participation, particularly amongst those who may never have screened or were under-screened. Self-testing was and has been available since 2018, but it was to a limited population of the under-screened. Sadly, we've not seen the uptake that we might have hoped for, and so now screening and self-testing is being made available for everyone.
With the new eligibility criteria, I'm confident that we're going to increase our participation in our National Cervical Screening Program, and of course in turn we'd expect this to save still more lives. Anytime a co-test is required, we cannot use self-collection, and this is because the vaginal sample is not suitable for cytology, which must be collected from the cervix. You'll be aware, of course, that co-tests are required for patients who have symptoms and signs suspicious of cancer, those who've been exposed to DES in utero, and those who are in follow-up from high-grade abnormalities that have been treated, such as HSIL and AIS. Self-collection is, of course, safe in pregnancy.
Ideally, self-collection should be performed in a clinic. However, to maximise participation, if the clinician feels it's appropriate, the self-testing can be done at another location, for example, in the context of telehealth. People who have difficulty collecting a lower vaginal sample can be assisted to do so. This would include people with disabilities or limited mobility, as of course maximising participation is always our priority. This would still be considered self-testing.
If you're a clinician who hasn't previously offered self-collection, you'll find that it's really straightforward and in fact probably saves time over a speculum exam. The important thing is though, before you get started, just check with your lab that you've got the right equipment and instructions for self-collection. We've been studying self-collection here at the Australian Centre for Prevention of Cervical Cancer for nearly 10 years. We're really excited about this change to policy, and we think it's going to be a game changer in reaching people we haven't previously been able to reach. So please check your records, talk to your patients who are due or overdue for screening, and make the offer of self-collection to them. Together we can help eliminate cervical cancer in Australia.